We're on to learning unit number 10, which is women's and children's health. Now, we've spoken a lot about women's health, and you've had an assignment, your opposing viewpoints paper, and the sources of information for that included a lot of information about women's health. So we're going to switch gears a little bit and we're going to look a little bit more at children's health as well, and especially infant and infant mortality. So when we're looking at the topic, we know that women face a number of really unique health problems by virtue of their gender and their place in society. So, and these health problems that include disability, premature death, can have enormous social and economic consequences. So it's really essential that we look at ways in which to improve the health of women, offer appropriate services, decrease discrimination, and empower women and girls. And this is globally, including the U.S. And so a common theme of this unit is one of hope and dreams, even when the realities remain harsh in many areas of the world. And as we will see with infant mortality, the realities of infant mortality, and especially in states such as Kansas and Mississippi, are really harsh. So, in other words, high levels of infant mortality in our country. So, we're going to look at a few things, discuss the reasons for these high rates of infant and maternal mortality, especially infant mortality. And so, we're going to do it by looking at some videos, audios, web links, articles, the usual, along with our readings in Skolnick. Now, the one difference will be your discussion board post. There will be a question that you need to respond to, but when you reply to your classmate, you're going to have a very specific question to answer in your reply. And of course, then there's quiz 10. So let's move on and look at these, just keep switching over. So you're watching this video. The required readings, it's both chapters 10 and 11. So that 10 covers women's health, 11 covers the health of young children globally. But because there are two chapters this week, I ask that you focus on the following. And so you're going to look in chapter 10 at figure 10.1. You're going to read some of the pages as noted here. In chapter 11, again, only a couple of pages from 307 to 309 and then 318 to 321. So this is from your Skolnick text, but you don't have to really read the full two chapters. I want you to focus on specifics of these pages. And you will have a quiz on the textbook readings. So your quiz is going to be limited to an hour, but again, in one sitting. Have your book available to you so you can best respond as far as a review. I do ask that you're reading your text. So then this is an article by OECD. It's not an article. It is a short video, but it's chock full of information and will be really helpful for your discussion boards. And OECD is the intergovernmental agency that we've looked at in the past as far as comparing a lot of health issues between countries and wealthier countries. So we've looked at OECD data before. That's the Organizations for Economic Cooperation and Developmental. So there's over 100 member countries that participate in this organization. And the OECD works to build better policies for better lives. That sounds pretty easy. Better policies for better lives. and they provide data and advice on public policy to help make evidence, help these countries, the 100-member countries, to make evidence-based decisions when they're making policies. So this is important because if you think of it, our country is changing a lot of the policies. We're changing Medicaid funding. We're changing a lot of things in our country. So are we looking at the data? As we go forward, I know a lot of you spoke about universal health care, and we're pro universal health care for our country. So are we looking at the evidence of other countries that have universal coverage as we make our own decisions and governmental decisions about health care? So it's an important agency. We are a member country, and I hope we're using the data that is provided by OECD to make some of our policy decisions truly evidence-based. So that's a short video. Here is an article that, again, is going to offer you a lot of strong help in, I can't seem to move this over, a lot of help in answering your discussion board. So here we find that U.S. has the highest infant and maternal mortality rates despite the most healthcare spending. Again, this is from high income countries. I'm not saying we have a higher infant mortality rate than low income countries, but I am saying we do have the highest infant and maternal mortality rates, compared to other high income countries, and despite the fact that we spend the most on healthcare spending. So let's come back to here. This is NPR. It's a recent audio. And so you're just going to click on the 5-minute listen. But we also have the transcript here. Every once in a while, I had a difficult time in getting this to go. But it is an interesting audio story from National Public Radio, NPR. Again, another one that's going to really help you respond in your discussion board post. So what is that discussion board post? Well, after reviewing all the sources of information that you've been provided this week, I want you to share with us. Let's open it. It'll be easier to read. I want you to share with us in your post, why does the U.S. have extremely high rates of infant and maternal mortality and racial disparities in infant mortality? So why the U.S. Has extremely high rates of infant and maternal mortality, so both the infant and the mom, and also racial disparities in infant mortality. And then one idea of that you think of that can be done, or based on the evidence that you read, one idea that can be done to lower these rates. Now, the difference is going to be for your reply. You're going to reply to one of your classmates' posts, but specifically you're going to answer which of the course student learning outcomes, and to see those, you go to page 2 of your syllabus, was demonstrated by your classmate's post. And what specifically was written by your classmate to demonstrate meeting this course student learning outcome. So it's a very specific discussion board. If you go back to the beginning, to the start here, you're going to see that the syllabus is found within here, and you can look at the syllabus. You would go to page 2 of the syllabus, And you will see at the top of the page, sorry again, this seems to be keep moving here, but you're going to see at the top of this page here, course student learning outcomes. So this is the nursing program that you're in, the end of program student learning outcomes for your nursing program. This is specific to what is expected for you to learn by the end of this course. And then these are essentials for baccalaureate education. So you can see there's 1, 2, 3, 4, 5 course student learning outcomes. So you're going to respond which one of these course student learning outcomes did your classmate demonstrate meeting, and why? What did they write? What did they say that showed that they met this course student learning outcome? So that is learning unit number 10. We're certainly moving along, and we're getting closer to now the end of the semester than the beginning of the semester. So we keep moving along, and I'm just looking back here as far as we will have a few more learning units before finishing this course. So keep on doing the good work that you're doing. Thank you.